Hello everyone. Welcome to today's interview. My name is Sue Barrosse and I'm Director of Admissions for Tulane University School of Public Health and Tropical Medicine. Today's topic is the coronavirus, and my guest today is Dr. Susan Hassig, a professor in our epidemiology department. Welcome, Dr. Hassig. Thank you for joining us today.
Thank you, Sue, for having me.
Would you like to introduce yourself to our audience?
Sure. My name is Susan Hassig. I'm an infectious disease epidemiologist. I actually did my training here at Tulane at the MPH and the doctoral level, and then went off to do HIV/AIDS related research and prevention activities for a number of years before rejoining the faculty, coming back to Tulane to rejoin the faculty about 20 years ago. I teach courses in infectious disease epidemiology and particularly in outbreak investigation. So this is an area that I am very familiar with.
Well, let's start by having you explain what is coronavirus and how is it spread?
Of course. It's really important to know what it is we're thinking about. The coronavirus, this current one that we're concerned about that causes COVID-19 disease, is one of a very large family of viruses. These viruses have been recognized for a number of decades, in fact, as early as the 60s. And a number of them have been circulating in human populations for quite some time, causing what we would call the common cold. However, more recently, two other coronaviruses have emerged, the one that is associated with SARS and the one associated with MERS, that, as this one has, is causing more problems for humans that are infected with it. As many other coronaviruses and many other viruses in general, these viruses are spread through respiratory droplets. When a person is infected, and particularly when they become symptomatic and actually ill with the virus, when they cough or sneeze or sometimes even speak, they will project droplets from their respiratory tract that include virus particles. And these droplets will travel a relatively short distance, 3 to 6 feet from the person. And so it is these droplets that can be transmitting the infection to people who are within that sphere of distance, as close as Sue and I are here today, or they can fall to a surface like a tabletop, where they may rest and survive for a period of time and be contacted or touched by another individual who then brings it with their hand up to their mouth by touching their eyes and their nose and their mouth and introducing it to their own respiratory tract and becoming infected. So it can be a disease, an infection that can spread quite easily, much as the flu spreads.
Mm-hmm. Well, you mentioned SARS and you mentioned the flu. Can you tell us if this is similar at all to those two?
It is similar and in some ways different. SARS was a problem in the early 2000s, 2003, severe acute respiratory syndrome. What was different about SARS is that we didn't know what was causing it for some time. And when we were tracking individuals that appeared to be sick with it, we really only had their clinical symptomology to go with. And it was a very severe presentation, hence the name. But it also seemed to be an infection that did not spread as easily as this current infection appears to be spreading. It was primarily a problem that was confined to healthcare, where the ill patients would go into a hospital, the healthcare workers would treat them, potentially themselves become infected, transfer it to other patients. So SARS was much more a problem within the healthcare environment rather than the general community, as we are starting to see with this current coronavirus. The influenza virus, the 2009 novel strain that we were concerned about a little over a decade ago, or even the seasonal influenza, seems to behave much more like this current coronavirus does, in that it can cause widespread illness, potentially, or certainly widespread infection, and in some individuals cause some very severe disease that may result in death. And so they are all spread the same way through that droplet mechanism that I talked about a bit earlier. But the degree to which people, or the speed or the easiness by which people acquire that infection does appear to be somewhat different. But one of the things that's important to remember about this particular problem that we're dealing with now is that we are still learning about it. And so as we gather more information from more locations, we're able to investigate more thoroughly the spread of the virus, as well as the clinical experience of people infected with the virus. We'll continue to understand it better.
That's very interesting. Dr. Hassig, when I'm home watching the news on television, there's a lot of numbers that are reported. Can you explain what these mean?
I can certainly explain what some of them mean, or at least attempt to. One of the things that we are all hearing on the news a lot is when there is a new case, quote unquote, being identified or diagnosed. And what's important to recognize is that those new cases may actually represent a lot of different presentations or connections with the coronavirus. In many cases, they may indicate that individuals have been identified as being infected with the virus, not necessarily sick with the virus. In other cases, it may be that people are very sick with the virus and have been identified as being infected, or perhaps just assumed to be infected. So one of the challenges we have is really understanding what that number means. What I will tell you is I suspect that it is generally an indication of how the lowest possible number of infections that we have in any given location, because only finding sick people or people connected to sick people is going to be just part of what is likely to be the infection burden within a particular community. So it's important, I think, not to worry about the numbers that are being reported necessarily on a day-to-day basis in terms of their magnitude, but rather to pay attention to where they are being identified. Because that is important in terms of understanding what perhaps you or your family or friends may need to think about in terms of how focused you might want to be in terms of your own efforts to protect and prevent the exposure to this infection. One of the other numbers we often hear about are the number of deaths. Obviously, we're very concerned with a serious outcome to this infection. And obviously trying to understand what those numbers might mean. We still have a real challenge with that, because in an outbreak, frequently the most serious cases are the ones that are identified first. And so we find people who are very sick, and they are also people who it may be more difficult to prevent them from dying. And so it's important to recognize that in many, many outbreaks, we will often see much higher death occurring in the earlier phases of it, which is where we are with this particular outbreak, than we will a little bit later on, when the public health and medical community have a better understanding of how to take care of people who may be infected with this virus.
Thank you. In other reports, I see that case fatalities differ among countries. Can you tell us what contributes to these differences?
Certainly. Case fatality is a way of thinking about the occurrence of death in people who are infected. And this is a measure that we see with a lot of outbreaks. We thought about case fatality with Ebola, for example, several years ago, and with the current outbreak that's going on now, and it's a very, very high case fatality. The case fatality that we're seeing currently with this coronavirus infection is relatively low, but it does differ from place to place. In Wuhan, for example, in China, their case fatality is about twice as high in terms of the reported infections and subsequent deaths than it is in other parts of China. And it is also a bit lower in non-China cases in countries around the world, in Europe, in the United States, in Italy, in South Korea, in terms of the deaths that are occurring in the identified cases in those countries as well. And very frequently we see this happen in outbreaks where the early cases, again, healthcare is not quite prepared to treat them and support them in an effective way. And also, individuals who we see becoming infected and experiencing severe illness with coronavirus often have other medical conditions. They are also often the ones that have been dying in China and in many other countries are often elderly. And older individuals have weakened immune systems, can't naturally fight the virus, and combined with often pre-existing heart disease or respiratory problems or diabetes, they have less resources, are more likely to experience a serious outcome. This is something we see with influenza as well in this country and countries all around the world. So I think we need to be a little cautious about assuming that we really have a good answer for case fatality yet, because it is still early on in the outbreak.
Well, Susan, there's so much concern about this virus. Do you have any advice for those of us who have these concerns?
Absolutely.
Thank you.
My first piece of advice is to try and relax a little bit. It is a potentially really important problem to deal with, but it is something that we have a tremendous amount of power to protect ourselves with. Washing your hands, that simple thing your mother told you to do every night before you ate dinner, is one of the best things you can do. It removes or decreases the likelihood that you are going to transfer an infection, coronavirus or influenza, from someplace in the environment or from someone else into your own respiratory tract. So washing your hands, not just once a day or twice a day, but with some regularity, particularly when you, for example, been in an environment, perhaps on the subway or on a public transportation, where many people may have touched surfaces that you may have touched. It's not a bad idea to wash your hands before you do something like eat your lunch or touch your face, as we all do many times a day. So it is important to wash your hands. That's one of the best ways to protect yourself. The other thing is to pay attention to those who you spend time with. If you're sitting on the couch watching Netflix with someone and they're coughing, encourage them to use a tissue to capture that cough, or to cough into the elbow to prevent both contaminating their hands and dispersing those droplets into the environment where they may rest and wait to be picked up and transferred into your own respiratory tract. If those kinds of things are really simple things that we can do, but they can be tremendously helpful in containing the spread. The other thing, because individuals who are older and who have pre-existing medical conditions appear to suffer more problems with coronavirus infection, I think it's also important to think about taking those actions, not just to protect yourself, but also to protect those who you may share a household with, to protect them keep from bringing that virus into an environment where someone who is potentially at greater risk of severe outcomes from an infection, whether it's flu or coronavirus, in terms of experiencing that. I think too it's important to remember that there is a lot of information available to you. And I would encourage you to go first to sites like the CDC website, to your state health department website, and not to someone's blog post on the internet. Go to credible scientific authorities for the most up-to-date and accurate information. The WHO, the CDC provide daily or every other day updates and have a lot of information about how you can help protect yourself. And that's also where you will find guidance about travel and recommendations on what to do if you are, for example, caring for someone who might be sick with a respiratory infection. So I strongly encourage you to take advantage of those sources of information as well. But the most important thing you can do is wash your hands.
Dr. Hassig, it's so helpful to have this informative information from one of the leading epidemiologists in our city. So thank you so much for joining us today and giving us all this very helpful information.
Well, thank you, Sue. I'm happy to help.
All right. I'm Sue Barrosse, and this is Dr. Susan Hassig, and thank you for joining us today. We'll see you next time.